I think one of the things that I really want to share with a lot of the patients who are struggling with losing weight is that sometimes people think it's their failure if they are not able to see results. Like it's more than just that. Like it's trying to understand how your body works, what nutrition, lifestyle fits for you, and be able to work with your body.
You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. Today, we're diving deep into the intersection of functional medicine, pharmaceuticals, and sustainable weight loss with Cynthia Lee, a clinical pharmacist turned functional medicine practitioner who's helping patients navigate chronic diseases like diabetes, cardiovascular issues, and obesity. Currently working in a weight loss clinic, Cynthia blends conventional medicine with holistic care, using lifestyle medicine, nutrition, movement, sleep optimization, and stress management to support long-term health goals. But what really sets her apart? Well, her personal journey after struggling with hormonal imbalances, weight issues, and fatigue is when she discovered functional medicine and transformed her health whenever the traditional healthcare system could not give her answers. In this episode, we're going to discuss why gut health is critical for sustainable weight management, the hidden lifestyle factors affecting weight loss beyond diet and exercise, the truth about GLP-1 medications like Ozempic, how they work, their benefits, and what you need to absolutely know before taking them, and how medications impact nutrient levels and what you can do to support your body naturally. Cynthia's background in biochemistry, pharmacology, and functional medicine makes her the perfect guide to break down these complex topics. Whether you're considering weight loss meds or looking for a root cause approach to lasting health, this episode is going to be packed with insightful and practical takeaways. If you have ever felt frustrated by the healthcare system or stuck in your weight loss journey, this conversation will empower you with the knowledge to take control of your health. Cynthia, welcome to the podcast. How are you?
Good. I'm doing great today. I'm excited.
Good. I'm really excited to have you here today. Now, you're a clinical pharmacist and functional medicine practitioner. You've got a lot of experience working with patients with chronic disease like diabetes, heart issues, obesity, and you're currently working in a weight loss clinic where you take this holistic care approach and conventional medicine and really combine weight loss meds with lifestyle medicine education on nutrition, movement, sleep, stress management, all of those things. So I absolutely love that.
Yeah, I'm glad to be here. I think I felt like very rewarding in the space, especially in the obesity clinic that I'm currently majorly working on, just because I see the empowerment that patients feel when I kind of start explaining about how their body works and all the intervention that we can do, all the tools so that they don't feel stuck anymore and able to move the needles. Yeah, really excited to share it more into the broader audiences and so that a lot more people can take control of their health
Yeah,
journey.
for sure. And whenever you know what's going on in your body more, like specifically you, not just like somebody general, but when like a patient can hear, okay, in your body, this is what's happening and this is what your numbers are reflecting, it does give you that sense of empowerment because it's okay, like this isn't all my fault. There's so much we can control, but there's the environmental factors and a slight genetic component. There's different things. And so I think that when people know exactly what's going on in their body, it is very empowering. And
Mm.
Cynthia, you really got into functional medicine too because you had your own health struggles, which, like, that's how I think all of us get into it. But you dealt with hormone imbalances, weight issues, mental health challenges. And so I'm sure it's just so rewarding to be over that and help other people.
Yeah, it is. Like before I come into functional medicine space, like I used to be a hospital pharmacist because I believe at that time I thought that's where I'm gonna make the most impact, like seeing patients get discharged with all this medication. That's wonderful back then. But over time, like I just see like frustrating trend. Like people don't get better. They keep coming back to
Right.
the hospital.
Being the
And
same ones over and over.
yeah, exactly. So it's there's something there there's a gap there. So I'm fortunate, I feel like that I get to learn more about functional medicine and it helps to give me answers in terms of my health issues. My family member have all chronic conditions with like multiple medication and my patients as well. It helps to see like why. Because sometimes when you go to the doctor, sometimes they do all this lab, all this imaging and stuff like that. They don't find anything wrong, but you yourself still feel something is there. Even my patients today, they come to me with weight loss issues. They have gone through all the labs, all the workup, and they don't find the answers. And then they just feel like, but I just can't lose weight. There's something in me, like hormonal, or something going on there that's just not right. And we need to find this out. I think that's where internal medicine helps to identify root causes, really identify early what's going on underlyingly. Yeah.
Yeah, for sure. And like I worked in hospital setting too for a long time. And so I think for people like us who have been on that side of the healthcare and been giving the care and have seen people over and over just not really get better and be just in this cycle over and over again. But then for us also to have been patients and be on that side, like we can bring just a whole different perspective on how we approach our health. I went to the doctor for so many different things and at the same time was not really given a why or this is just how it is or this is a pill for that. And that's also, like, what you and I were taught too. They don't know any different, but I think coming to somebody like you or I with a health concern, even if we don't know the why, like, we know how to get there. Like,
Yeah.
that's where we've been trained. And so, it's just a whole different approach to it. It's all just so very interesting. So, I'm curious though, as far as weight loss goes, because everybody wants to lose weight. Majority of people. Yes, okay, there are some people out there who are trying to gain weight.
Mhm.
Definitely, but a lot of people wanna lose weight. So,
Yeah.
why is gut health specifically just important for weight management in your opinion?
Yeah, yeah. I learned this over time as well as I start like seeing more and more patients who want to lose weight. And after I feel like years working with them, I figure out a few things. And I start doing that now, which helps a lot and actually give them a lot more empowerment in the beginning, like for all the patients that, comes to me. I think gut health is one of the things that I assess the first thing and kind of the body stress level in a sense. I think there's a lot of big belief here. Like when people try to lose weight, they're cutting out calories, burning more than you eat is like the equation that they're looking for. But and not just that, it's really more than that. Unfortunately, our body is complex. It works great when we work with it. And like cutting out calories, like exercising too much, it might work in the short term and you might see weight loss here and there, but it's not sustainable. Not like eating just once daily meal or just eating salad every day. It is not sustainable and you get stressed out long term wise. So lacking of nutrition, I feel like because of that whole like cycle that they're going through, like eating very little or not eating the right thing or nutritious thing, exercising too much sometimes can backfire. Those cause a lot of stress in the body. So those are the two things, the very common trend that I really see in my patients. And we have to address that. And that is where like a lot of educations we can give to our patients, like trying to educate them on nutrition, right? Like when you're not eating enough or eating enough nutrients, vitamins, minerals, protein, very important for muscle mass and metabolism, then you're not getting there. And I think the other thing, like considering the gut health, right? If you're already eating the right thing, if your gut is not functioning, your food needs to get into your system. And the way they do that, you have to have good digestion, good absorption, good motility, making sure that you are eliminating properly with your regular bowel movement. If those all are not functioning properly, then you're not getting the optimal thing that you're getting from the food. So that's where I feel like the most common issues that's going on today, like at least majority of the patients that I see. And that's where I feel like we can help a lot in terms of educating on nutrition, making sure that we are optimizing the gut functioning, setting other tools that maybe can help with personalizing what they're eating, what they're
Right.
exercising and such. Yeah.
Yeah, and I think there's, like, that big misconception of all calories are created equal, but that's definitely not the case, and I think that more people are seeing that and, like, understanding that, but knowledge is power, and I think a lot of it, like you're saying, is just educating people on these things, and even, like, you and I, we didn't really understand this or know this until we had our own health struggles and really studied functional medicine and looked further into it, so some of this basic knowledge on appropriate nutrition for your body. Like, it's not taught in school
Yeah.
if you're going to be a pharmacist or a doctor, and so it's definitely a learning curve, and so people out there listening, like, I know it sounds very overwhelming, and it can be, but, like, you and I, Cynthia, we were pretty overwhelmed with this at one point too.
It is. It takes me years to get answers, get like my gut functioning. So it still take years even for me as a healthcare professional.
And we constantly are having to remind ourselves of these things too, but making sure because it can get really overwhelming, and if you are trying to lose weight and be healthy and just trying to optimize your lifestyle, find somebody who can guide you through it, and don't try to just do it all on your own. That's really important too. Now, I know that we talked about, like, nutrition, but what are some other lifestyle factors that may impact weight loss, like, besides really eating healthy and exercising?
Yes. I think the two most thing that people don't realize, and it's happening every day nowadays, and especially with the exposure that we got to is stress and sleep. I would say stress is inevitable. I feel like even me still struggling daily. So I think one really education that I really tell patients and I give them an aha moment what's going on in their body and everything else is stress. And there's two types of stress. One is acute stress, one is chronic stress. Acute is when you are like outside and you find something stressful, like just one episode thing kind of thing. And then your body start producing the stress hormone cortisol. And then if it goes to balancing again, so to the baseline, that's great. Like you go with your own way through the day. But
We need that. Like, that's good
yes,
stress.
correct. Yes,
That's
exactly.
protective for our bodies. Yeah.
Exactly, exactly. We need stress every day in the morning to wake up, to start the day. We do need that. But the chronic stress is the one that actually make our life out of whack nowadays. And one thing that I observe too, like when I see the chart of my patients who have struggled with losing weight, they have mental health disorders, anxiety, depression. A couple are actually a lot more, maybe 20, 30% have trauma history. So
Yeah.
that's the issues there or like the underlying things that we need to address because that causes those patients to have chronic stress. And when you have
Right.
chronic stress, you're continuously producing this like cortisol hormone, not just like a one-time thing anymore. And that causes a lot of biochemical processes in the body that one, it can lead to insulin resistance. We can talk about it more if we want to kind of dive into it. But when you have all these things going on, it starts storing more fat. Like the body slows down metabolism because it's trying to conserve that energy and not
Right.
wanting to burn it. And that's how, like, even if they're eating healthy, eating less, exercising so much, and sometimes it can backfire if you're over exercising as well it's just hard for them to lose weight and they start thinking that they're failing themselves and causing more stress. It just becomes a cycle. So, yeah.
Yeah, and just taking a holistic approach to your health is gonna be the answer because it's like everybody has underlying trauma of some sort, and if you're not addressing this underlying trauma and just the chronic stress that your body has been under, whether it's mentally, physically, whatever, like, you're gonna hold on to that weight, and yeah, it's just a holistic approach if you really want to truly keep the weight off, yeah. And I know that GLP-1s are, like, all the rage right now, and I'm curious if you can explain how exactly GLP-1s work, what your take is on that.
Yeah, definitely. It is very popular. It's like it's number one. I feel like a drug that I prescribe most of the times. GLP, it absolutely does wonders. Like it helps my people. It changed their life. I think, and we can talk about how they do it for patients. But I would want to emphasize here, it's not a magic fix. I think patients that come to me like they get excited when they start on Ozempic and they want to like to continue. Like they get motivated. Oh, finally, I can make a change. They do, like I mentioned, right? They do really work for majority of people, I would say, although there are a couple where it's just not working for them. But the way it works, it is a hormone. So our body can actually produce this hormone naturally, endogenously, without synthetic or getting in from external products, and does help to regulate how we eat our food, how our body process food. It got released in the body when you ingest food. So particularly when you eat carbohydrates or fats, it starts triggering the body to release it. And once it got released, it actually slows down gastric emptying. It makes you feel fuller when your food stays in the stomach longer, reducing sugar absorption in that way. So it regulates your blood sugar better. And it also regulates the insulin hormone, which regulates your blood sugar in the body to make it stabilize a little bit better. And it goes to your brain. There's a lot of receptors of GLP in all over the body. So it targets a lot of organs as well, like heart, your brain. It has been shown to be protective towards those organs. And in the brain, it go to that centers that control the appetite to reduce your appetite in general. So a lot of people, after they start this medication, the most trend that I heard is that, oh yeah, I just don't have the food noises anymore. It liberates me so much. And yeah, it is crazy to listen to their experience, essentially. And I think like it makes sense a lot of times. I saw some studies that shows overweight individuals tend to have lower responses to GLP-1. Either their receptors are not as sensitive or they're just not making as much as non-overweight patients. Yeah, and that's why probably it's harder for them to control their appetite, hunger, and have those food craving in general. Yeah.
Yeah, that's interesting. So, whenever somebody comes to you and wants to lose weight, and maybe it's like their first time seeing you and they're like, okay, I want the weight loss shot. It just seems like nowadays a lot of people I see on Facebook and all kinds of stuff, they're like, where can I get the weight loss shot? Where can I get the weight loss shot? Is it that easy to get?
It is a very complex question. I think one, before somebody even consider doing GLP-1, either from your providers or there's a lot of companies now that are doing it like literally over the counter, like you can just get it
Right.
online. I think people will get excited in the beginning because they hit all this good stuff about it. But like I mentioned earlier, it's not a magic fix. And it does require commitment because there's a lot of things that's going on. Every medication have side effects, including GLP, and sometimes the people can be very sensitive to it, and they experience severe side effects. And when you talk about gut health and the importance of it to make sure that you have sustainable long-term weight management, GLP can wreck it out. All the side effects like nausea, vomiting, it delays your stomach emptying. So a lot of people
Maybe
comes
some
from
constipation.
constipation. Exactly. It does cause a lot of imbalance in the gut when you experience those severe side effects. So that's definitely one thing that people need to consider before going in. And I think like the other thing is that I get this question a lot more, which makes me happy because like people try to consider it before they go into GLP-1.
Yeah.
So
You want
that
the questions. Ask all the questions.
exactly,
Yeah.
exactly. Now people are asking me like, how long am I going to be on this? What happened afterward? And to be honest, like we're still learning more and more about it. GLP-1 has only been approved for weight loss since 2021. That's the
Yeah.
first GLP. So it's only been what, 3, 4 years, not even 5 years.
Yeah.
So there's still a lot that we are learning more about this medication. And duration wise, I would say everybody varies
Right.
depending on where they start, how much weight they are targeting to lose, where they are at the lifestyle. Because I see most results when people pair it with effort on like lifestyle, nutrition,
Sure.
exercises, stress management, sleep. So if they don't do all that stuff, like that's where I feel like people get to struggle, like plateau or get a roadblock in between. So definitely a lot of things to consider. And afterwards, I've had some patients who are able to get off of it, which is great, amazing. They got
Mhm.
results. We are able to taper down the Ozempic off from her and they're able to sustainable lose it. But for those who are not being monitored or like working with somebody to really maintain that after they get off of the Ozempic, there are a lot more reports now, like where they rebound back with their weight gain or even more than the weight
Right.
that they was
Right.
on before. Definitely a lot of consideration, a lot of commitment. Definitely it is a journey. Like it can be years for some, it can be months. Sometimes you might be on Ozempic for a longer time. And sometimes you go to roadblocks recently, like we have coverage for GLP-1 medications being cut for some insurance companies and
Right.
they have to get off of it like cold turkey, which is not recommended because of the weight rebound issue. And we have to rely on our foundation, like lifestyle, and
Yeah.
to make sure that we can continue moving forward instead of going backwards again. Yeah.
Yeah, I love that you emphasize that. I get that question a lot. Like a lot of people message me and just ask me my take on weight loss meds and that kind of thing. And so I think it's just really important to answer those questions and inform people. And with any medication, I always recommend to people that you've got to make your own decision. I'm not for or against something. Just in my opinion, I'm not. But just like any other medication, use it as a tool. If you are on a weight loss journey and you're like, okay, I've hit a plateau, I can't get any further, and the pros and cons of that medication, and you choose to do it, like more power to you. That's awesome. But if you have no idea what your plan is as far as how long you're going to be on it, or have somebody to guide you through that, whenever
Yeah.
you do figure out if you want to get off of it, you're just going into it blindly, taking something because you think it's a quick fix. Like, shame on you. Like, you need to
Yeah.
know better. You take care of yourself. Be informed,
Yeah.
you know?
Yeah. Yeah.
And I've seen some studies and heard different case studies where somebody will be on a GLP-1 and maybe not be closely monitored by their prescriber and lose a lot of weight fast. And while that might sound great to some people, a lot of times it's that lean body mass that we lose, all that muscle that we lose first. And
Yeah.
so that's where it's okay, you do need somebody telling you about the foundation. Like you've got to keep those in line, making sure that you are eating enough protein to sustain your muscle mass and that you are moving your body. Because if you get off of this GLP-1 and you've lost all this muscle mass, especially us ladies, like the
Yeah.
older we get, we lose muscle mass anyway, and then we're more prone to fractures anyway because of our decline of estrogen. It's like this cycle. Ladies, we gotta take care of ourselves. If we're having children and we're making the future, like, we gotta take care of ourselves.
Yeah.
I've heard different case studies where a lot of women will get off of the GLP-1, they will lose all they might gain the weight back, but it's different kind of fat. It's like a bunch of that visceral fat, and they don't gain the muscle back, and so we gotta work hard to gain that muscle anyway. Muscle weighs more than fat. It's so complex. There's so many different things in there, but
Yeah.
just having somebody, like, guide you through, "Okay, these are the pros and cons. This is what you need to be doing while you're using this tool," instead of just, like, doing that medication by itself. It makes so much sense. It's like somebody on medication for anxiety or depression, like, you still should be going to therapy. You still should be working on that. Blood pressure medicine, like, you still need to be working on your blood pressure, eating better, and maintaining all of that. So, it's the same thing with a weight loss medicine, but people need to hear that.
Yes, yes. And I think that's also why a lot of people get excited just because they see the results from other people. But a lot of times social media doesn't portray as much on what is it like afterwards, because maybe some people don't share that or don't feel comfortable in sharing those. There's a lot more studies now reporting what happens
Right.
afterwards. It's just good to get where the right news are, because I feel like now, like with sea of information out there, social media news and everything else, it's just hard. Like even for me, sometimes like I don't know which one to trust anymore, which one are not. Yeah. So
It can
yeah.
be confusing for sure. And I know that you were talking about like insurance coverage with some of this, and I know that varies based on like insurance carriers, stuff like that. But some of these medicines are great for people with diabetes, and some of them are specifically for weight loss as far as the GLP ones go. So can you just differentiate that and clear up? I know there's like Mounjaro, Wegovy, all of these different things. So which ones are for weight loss or have been approved for weight loss?
Yeah, I know it's very confusing because there's so much names in it. So yeah, GLP-1 agonist, there's like multiple drugs on it. Like the main common one that we use or we see more. I'm gonna talk about main ingredients or the generic name. Semaglutide is gonna be the most popular one. Their brand name is Ozempic and Wegovy. Why is there two brand names with just one drug? Ozempic is first approved for diabetes a long time ago, a little bit over the decade. And then Wegovy came, like that's 2021. It came out and it got approved for weight loss. So both of them are literally the same medication. Maybe Wegovy have a little bit different doses in a sense, like a little bit more, but in general, they are the same active ingredient. Liraglutide is another one, but I feel like it's less being used compared to Ozempic just because Ozempic is once weekly versus liraglutide, they take it once daily. Yeah, so Ozempic, Wegovy. And then we recently have a new approval for weight loss medication, Mounjaro, Zepbound. It's just a brand name. One of them are for diabetes, one of them for weight loss. Thankfully, we don't have to go to there yet for some of our patients. I think the difference between Mounjaro, Zepbound versus Ozempic, Wegovy is that they have another hormone that got input there. It's the GIP hormone on addition to the GLP-1. which have the same benefits or kind of a mechanism to help with the insulin sensitivity, stabilizing blood sugar, reducing appetite, hunger, like the same, but a little bit more potent with both working together in the body. So yeah, like hopefully that kind of explain a little bit between all those like soup of names for weight loss medication.
Yeah. Yeah, and there's a lot out there, and it's very popular right now, and people always have a bunch of questions.
Uh,
It's been really informative for me, though.
yeah,
Like I said, I get a lot of questions about weight loss meds, and
yeah,
I think there's a time and a place, but you definitely need to be informed and know
yeah.
all the ins and outs of it.
So this is just recently, but within a month, I would say, Ozempic, the one that have the GIP medication, it just got approved now for OSA.
Yes, I did see that.
Yeah, yeah. So it makes people, and obviously, sleep, OSA, obstructive sleep apnea, like definitely it goes hand in hand with a lot of my weight loss patients as well. A
Right.
lot of times I see it. And it's just like in cycles. And I think like a lot of people, they're maybe like they're still trying to learn more on how it helps the OSA, but majority of the time is because of the weight loss too.
Yeah.
Yeah, definitely we can work on the weight loss instead of thinking about having this like luxury like medication and stuff like that. So I feel like a lot of times that people will be like, oh, if I don't have this medication, I don't lose weight or I don't get my sleep apnea better. But we can work with your weight loss lifestyle, strong foundation to help you with losing weight if people have trouble assessing this kind of medication for sure. Yeah.
Yeah. So, Cynthia, I know we can find you on farm to table. Do I just say farmtotable.com or is it farm to table?
Live. Yeah, that's where I'm able to practice functional medicine mostly and see people. I currently see patients who are residing in California, Illinois at this time. So if you go there and then search for a provider, I should be there.
Okay, awesome. And then I know we can also find you on Instagram at cynthia.lee.pharmd. And I'll be sure to link that in the show notes for anybody
Thank you. Thank
to
you.
check that out. Cynthia, is there anything else that you want to leave with our listeners today?
Yeah, I think one of the things that I really want to share with a lot of the patients who are struggling with losing weight is that sometimes people think it's their failure if they are not able to see results. Like it's more than just that. Like it's trying to understand how your body works, what nutrition's lifestyle fits for you, and be able to work with your body. And if you follow that, like you'll see the results and not be able to move the needle. So definitely don't feel like you're failing yourself if you don't see results and try to find somebody close to you, work with a provider that might have all the tools that can help you to lose weight, and we'll go from there. And I really want to empower a lot of people with that education. Yeah.
Awesome. Thank you, Cynthia. I know I'm very thankful for people like you, for pharmacists who know all the biochemistry and everything behind all of these medications and can inform us in this way. So thank you so much for being here today.
Thank you so much, Allison.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative. Hey there, it's Allison, and if you're anything like me, coffee is a non-negotiable part of your day. But did you know that most coffee is loaded with mold, toxins, and pesticides that could be messing up your gut and hormones? Yeah, no thanks. That's why I only drink Purity coffee. It's organic, tested for toxins, and it's packed with antioxidants that actually support your health instead of wrecking it. It's smooth, delicious, and best of all, it does not leave me feeling jittery or bloated. So if you're ready to upgrade your coffee game and support your gut at the same time, grab a bag of Purity coffee today. Your body will thank you. Oh, and because you are part of the What the Gut family, I've got a special link just for you. Just head to puritycoffee.com and use code AllisonGetsWell for 20% off your first order. Cheers to coffee that loves you back. Hey friend, let's talk about something real. Bloating, stomach pain, and fatigue. You do not have to live like this. I know because I was there too. I was frustrated, exhausted, and trying everything, but still felt miserable. And that's exactly why I created my Get Well one-on-one gut health coaching program to help women like you finally get to the root cause of your symptoms, heal your gut, and feel like yourself again. No more guessing, no more Band-Aid fixes, just real, sustainable solutions tailored to your body. So if you're ready to ditch the bloating, boost your energy, and actually enjoy food without discomfort, let's do this together. Head to AllisonGetsWell.com or reach out to me on Instagram at AllisonGetsWell to learn more and apply today. Because you deserve to feel good in your body every single day.